Disease of the aorta is very common, especially as our population gets older and older. And generally, it's aortic aneurysms. And an aneurysm is a swelling of the main artery in the body of the aortic aneurysm. And we, as cardiac surgeons, typically treat the part just above the heart. As the blood leaves the heart into the beginning of the aorta, that blood vessel can get quite large, especially in people who have high blood pressure. So we are now able, instead of, again, using a large incision, to work through very small incisions, or even with catheters, to replace portions of the aorta minimally invasively. A more scary aortic disease is something called aortic dissection. It shows up in the news every once in a while when we hear about famous people like John Ritter, who passed away from aortic dissection. And it's a tearing of the aorta, and it almost always means emergency surgery. So it's probably the most dramatic thing we deal with in cardiac surgery is aortic dissection. Nowadays, we're now developing tools to treat aortic dissection without opening the chest, with working through a small incision while the heart's still beating, and deliver various devices to treat the tear in the aorta without surgery.